Hello everyone, we are Group 24. My name is Ani Sofia and I'm a leader of this group with Nur Shahada, Nur Adila Sazwani and Janati Rauda. Today, we will be presenting our video on comparisons between Toremifene and Tamoxifen drugs. Let's begin.
Let's get to know about two kinds of drugs that are important in treat breast cancer. The first one is Toremifene, which is the brand that we all know as Novadox, and the drug classification for it is anti-estrogen. And the pharmacological class for Toremifene is SERMs, which is selective estrogen receptor modulator and known as a non-steroidal anti-estrogen. As the second drug is known as Tamoxifen, and the well-known brand is TGP, and the same goes with Toremifene. It falls under anti-estrogen class.
Next is therapeutic indication and clinical use, which is Toremifene is used to treat advanced breast cancer and has been part of adjuvant therapy since 1995. It is commonly used for metastatic breast cancer in postmenopausal women with estrogen receptor positive or unknown tumors. Another clinical use of Toremifene is in prostate cancer prevention. It is used as a preventative treatment in men with high-grade prostatic intraepithelial neoplasia, showing that the drug is useful for both men and women. Comparing to Tamoxifen, it is used to treat breast cancer too, including metastatic disease. It is also used in early-stage breast cancer, especially for estrogen receptor positive tumors. Tamoxifen is often given as adjuvant therapy after surgery to help reduce the risk of cancer from coming back.
Now, let's take a look at the mechanism of action and chemical composition of Toremifene and Tamoxifen. The mechanism of action of Toremifene is it will competitively bind to the estrogen receptor of tumor to block estrogen-induced stimulation of DNA synthesis and cell replication. And as for Toremifene, it derived from a tertiary amine, an organochlorine compound as an aromatic actor. It has a role as an anti-neoplastic agent, an estrogen antagonist, and estrogen receptor modulator. And it also have a bone density conservation agent that derive from a hydride of stilbene. In the breast cancer, tamoxifen will compete with estrogen at the binding sites that could slow the cancer cell growth, which is giving a cytostatic effect, and thus help to treat estrogen receptor positive breast cancer. The chemical composition of tamoxifen is a triphenylethylene derivative.
Pharmacokinetics of Toremifene is well absorbed when taken by mouth, which means it has high bioavailability. Once in the body, it is mainly metabolized in the liver by cytochrome P450 enzyme system, especially the CYP3A4 enzyme. After metabolism, about 70% of the drug is excreted through the feces and around 10% through urine. The elimination half-life of Toremifene is approximately 3 to 4 days, meaning it stays in the body for a few days before being cleared. Comparing to Tamoxifen, it is also well absorbed early and has high bioavailability. It is metabolized in the liver by multiple cytochrome P450 enzymes, including CYP3A4, CYP2C9, and CYP2D6. Around 65% of tamoxifen is excreted in feces and about 9% in urine. Its half-life is longer than Toremifene, lasting around 5 to 7 days. Now I will state the clinical characteristics of the patient population that are best treated by these drugs. Tamoxifen is used for women who have a high risk of breast cancer to help lower their chances of getting it. Women who had a surgery for a type of early breast cancer called DCIS with hormone-positive tumors take tamoxifen for 5 years to stop the cancer from coming back in the same breast. It is also used for women with hormone-positive breast cancer after the surgery to lower the chance of the cancer returning. For women whose breast cancer has spread, tamoxifen can help slow or stop the cancer and may shrink some tumors. Although Toremifene works like tamoxifen, but it is used less often. It is only approved for postmenopausal women with metastatic breast cancer.
I'm gonna talk the dosage and administration between Toremifene and Tamoxifen. For the Toremifene, patients with metastatic breast cancer in postmenopausal women come in 60 mg tablet, need to be taken once daily, while for the Tamoxifen, patient with breast cancer in pre and postmenopausal women, metastatic breast cancer or breast cancer prevention, it comes with 20 mg tablet that need to be taken once daily. Both of these drugs can be taken with or without foods, and the most important thing is both of these drugs need to be taken at the same time for each day. Patient need to take the Toremifene until there is improvement of the disease is being observed, and while for the Tamoxifen, it depends on the disease, but usually to treat the breast cancer it can be 5 to 10 years. Both of these drug can cause nausea and hot flashes, so patient need to eating small portion of a meal and wear thin fabric clothes. But as for Toremifene, sweating and vaginal discharge can be likely occur, while the Tamoxifen, it can cause weight gain and fatigue.
Now, let we talk about contact indication and precaution for both drugs. I will talk about the contact indication for the tamoxifen first. It's contact indicated in patients with a history of blockade, such as a DVT or pulmonary embolism. This is because tamoxifen increase the risk of thrombolytic event and should be avoided who anyone with no allergic to the drug. In contrast, Tamoxifen is more associated with the cardiac risk. It's complicated in patients with bradycardia, heart failure with a reduced injection fraction, or electrolyte disturbance, as this can increase the risk of QT prolonged. In terms of precaution, tamoxifen should be used in the care in premenopausal women and those who are poor metabolized of CY2D6. For tamoxifen, we need to monitor patients with a liver issue, hypertension, or diabetes. For conclusion for this slide, I can summarize tamoxifen is more risky in patients prone to the class, while tamoxifen carries a high risk for those with a heart-related condition. Now, let we talk about the drug-drug interaction and drug-food interaction. For tamoxifen, the most serious concern is in interaction with warfarin. Warfarin can significantly increase the risk of bleeding and raise the clot risk when we use a cytotoxic chemotherapy. For the food interaction, grapefruit juice should be avoided because they can increase the drug level by inhibiting CYP3A4. For the tamoxifen, the focus on cardiac safety. It should not be combined with other QT prolonging medication that can increase the cholesterol level when we use the certain drug. For the food interaction, it's also have a contact indication with grape juice that can increase the serum conjugation. So this grapefruit should be avoided when taking Toremifene and Tamoxifen. To summarize, Tamoxifen may risk with the thrombolytism, where the Toremifene is more likely to cause a cardiac or metabolite disturbance. Finally, let us go over with storage and handling. For tamoxifen comes with two dosage forms, tablet and oral solution. For tablet should be stored with below 30 degrees Celsius and protect from the light. The oral solution must be stored between 20 and 35 degrees Celsius and should be not frozen or refrigerated. For tamoxifen have only a tablet form that should be stored at 25 degrees Celsius and also protect from light and heat. Since both drugs are used in cancer therapy, cytotoxic handling procedures are required that include the proper storage, administration, and safe disposal according in institutional guidelines. For highlight this point, both drugs are required care in handling, but tamoxifen oral solution has stricter storage requirement.
In conclusion, tamoxifen and toremifene are both selective estrogen receptor modulator that are used primarily to treat and prevent breast cancer. With having toremifene basically help with a patient that cannot tolerate tamoxifen. This is because there's a study that show that tamoxifen may increase the risk of blood clots, endometrial cancer, and the hot flashes, while toremifene has a slightly lower risk of the endometrial cancer. In the drug selection of treating breast cancer, it will depend on the patient-specific factors such as the side effect, genetic, and menopausal status. And to conclude that both drugs are effective in the treating breast cancer.